Hi, I'm Dr. Nevicia Case, and I'm a 2025 Education and Advocacy Fellow with Results Canada. In December 2024, I began my role as the inaugural Manager of Black Health, Innovation and Advancement in the Cummings School of Medicine at the University of Calgary. This is the first full-time role of its kind in any faculty of medicine across Canada. And it's the result of years of strong advocacy by Black faculty, physicians, and students. Here's a little bit of my personal history that has brought me to this moment. I'm of Afro-Guyanese and Indo-Trinidadian descent, and I was born and raised in Edmonton, Alberta. I also lived in Calgary and Montreal as I pursued training in neuropsychology and mental health research. After my PhD, I did a postdoctoral fellowship in health law at the University of Alberta. A major focus of this work, which was funded by the Stem Cell Network, was on addressing inequities in the flow of scientific knowledge, which tends to go from the global north to the global south, and rarely vice versa, even when the people most strongly affected are in the global south. My work has looked into capacity building in various countries across Africa and Asia, and what conditions they need to go ahead and innovate. What I love about innovation in low resource and rural settings is that it requires creativity and ingenuity, skills that we could learn a lot from in the global north if we want to stop overburdening our healthcare systems and neglecting our rural and Indigenous communities. Alongside my academics, I've also been heavily involved in the nonprofit sector, just as a general member, as a founding executive, and as a board member. These are nonprofits that lead a range of social justice and education projects. Recently, I took a leap in a more entrepreneurial direction, and I now offer my scientific research expertise to projects looking to center health equity in the work that they do. My work in Black health at the Cummings School of Medicine is cross-cutting and includes strategic planning, safe racism reporting mechanisms, increasing diversity among students, faculty, and physicians, and ensuring that medical conditions that disproportionately affect Black people are taught effectively and with empathy in the curriculum. Medical research and practice have a long history of anti-Black racism, both within and beyond Canada's borders. Non-consensual surgical research on slave women in the US, often without anesthesia, form the basis of modern Western gynecology. Black men with syphilis were left untreated without their consent, so that scientists could observe the disease progression. The list of examples continues, from dermatology to forced sterilizations to medical education, where Black people were historically excluded from Canadian medical schools. Black patients have been shown to have better outcomes when treated by Black doctors. But where are the Black doctors? With Alberta having the fastest growing Black population in Canada, we do not have time to remain stuck in unsubstantiated beliefs about Black bodies and Black people. While there is an urgent need to start locally, this work is being designed with the national and global contexts in mind, so that international medical graduates who call Alberta home can have the opportunity to bring fresh and innovative perspectives into our healthcare system. And the physicians who are trained in Alberta but choose to practice elsewhere can exude empathy and compassion. Happy Black History Month. Consider taking the opportunity to learn about how diverse Black communities approach health and wellness. And imagine, what do Black health and global health look like in several generations to come?